Hello, everyone, and welcome back to Creatively Homemade Health and Wellness. Today, we're going to tackle a topic that impacts so many of us, often quietly: anxiety. In a world that feels increasingly fast paced and demanding, moments of worry or nervousness are normal. But when these feelings become overwhelming, persistent, or interfere with our daily lives, it's important to understand what's happening and how to manage it. This presentation is a compassionate guide to recognizing anxiety, identifying its roots, and equipping you with practical strategies to find greater calm and well being. Let's begin our journey together. So, what exactly is anxiety? At its core, anxiety is a natural human emotion. It's our body's ancient fight or flight response, designed to protect us from danger. In small doses, it can even be helpful, like motivating you to meet a deadline or preparing for an important event. However, anxiety becomes a concern when these feelings of worry, nervousness, or unease are persistent, excessive, or disproportionate to the actual situation. It's when that internal alarm system gets stuck on, even when there's no immediate threat, significantly impacting your daily life and sense of peace. Anxiety isn't a single, uniform experience. It manifests in various ways. Let's touch upon some of the common types. First, generalized anxiety disorder, or GAD, is characterized by persistent, excessive worry about multiple things: work, health, relationships, everyday concerns, often without a specific trigger. Then there's social anxiety disorder, which involves an intense fear of social situations, driven by a worry of being judged, embarrassed, or humiliated. It can make everyday interactions feel daunting. Panic disorder is defined by recurrent, unexpected panic attacks, sudden, intense bursts of fear that can bring on alarming physical symptoms like a racing heart, shortness of breath, or dizziness, even when there's no real danger. And finally, specific phobias are intense, irrational fears of a particular object or a situation, such as heights, spiders, or flying. Understanding these distinctions can be the first step in finding the right support. So, what does anxiety feel like? It's often a complex mix of both physical and mental symptoms. Physically, you might experience a rapid heartbeat, sometimes feeling like your heart is pounding or fluttering, along with chest tightness. Shortness of breath or feeling like you can't get enough air is common, as are dizziness, sweating, and trembling. You might notice persistent muscle tension, leading to headaches or neck pain, and even digestive issues like nausea or an upset stomach. Chronic anxiety can also lead to pervasive fatigue and significant difficulty sleeping. Mentally and emotionally, anxiety often manifests as excessive, uncontrollable worry and racing thoughts. You might feel persistently irritability or restless, constantly on edge or keyed up. It can significantly impact your ability to concentrate and bring a sense of impending doom or danger, even when there's no logical reason for it. Recognizing these varied symptoms is key to acknowledging what you're experiencing. A crucial step in managing anxiety is identifying your personal triggers, what specifically sets off or intensifies your anxious feelings. Triggers can be broadly categorized into two types. External triggers are things outside of you, specific situations like public speaking or crowded places, certain people, or events like major deadlines or conflict. For example, knowing you have a big presentation might be an external trigger. Then there are internal triggers which arise from within. Specific thoughts like self-criticism, past memories or traumas, certain emotions, or even physical sensations like consuming too much caffeine or experiencing lack of sleep. A fantastic tool for unmasking these triggers is journaling. By regularly writing about your anxious moments, you can look for patterns and connections, beginning to understand what consistently precedes your anxiety. This reflection empowers you to anticipate and prepare rather than being caught off guard. Once you've identified potential triggers, the next step is to equip yourself with practical coping mechanisms. Let's start with arguably the most immediate and powerful tool: the power of your breath. Our breath is an incredible built-in anxiety regulator. When we're anxious, our breathing often becomes shallow and rapid, Deep, controlled breathing, specifically diaphragmatic or belly breathing, signals to our nervous system that we are safe. To practice, place one hand on your chest and one on your belly. Inhale slowly through your nose, feeling your belly rise. Exhale slowly through your mouth, feeling your belly fall. Try a simple count, like inhaling for a count of 4, holding for 2, and exhaling for 6. You can also try box breathing, which involves inhaling for 4 counts, holding for 4, exhaling for 4, and holding for 4. These techniques activate your parasympathetic nervous system, shifting your body from fight or flight into rest and digest mode, bringing immediate calm. When anxiety feels overwhelming, causing your thoughts to race or detach from reality, grounding techniques are invaluable. These practices are designed to bring you firmly back into the present moment by engaging your senses. A popular method is the 5-4-3-2-1 technique. Start by identifying 5 things you can see around you, then notice 4 things you can feel: the texture of your clothes, the chair beneath you, the air on your skin. Next, listen for 3 things you can hear: the hum of the refrigerator, distant traffic, your own breathing. Then identify 2 things you can smell, no matter how faint. And finally, 1 thing you can taste, even if it's just the lingering taste in your mouth. You can also use physical grounding techniques like firmly pressing your feet into the floor, holding an ice cube, or splashing cold water on your face. These simple actions redirect your focus from anxious thoughts to tangible sensory experiences, helping to calm your nervous system and recenter you. Anxiety often thrives on distorted thinking, leading us into negative spirals. Learning to challenge anxious thoughts is a powerful coping strategy that helps you rewire your mind. When you notice an anxious thought, pause and ask yourself some critical questions. First, is this thought 100% true? Often it's an assumption or a fear, not a fact. Next, am I catastrophizing? Am I making the situation far worse than it actually is? Then seek evidence. What's the actual evidence for this thought, and what's the evidence against it? This helps you see the situation more realistically. Finally, ask, what's a more balanced or realistic perspective? And importantly, what would I tell a friend who is having this exact thought? This practice helps you shift from a negative spiral to a more rational, hopeful outlook. It takes practice, but it's incredibly empowering. While immediate coping strategies are vital, building long-term resilience against anxiety involves integrating certain lifestyle practices. These are the foundations of overall well-being. Firstly, regular exercise is incredibly powerful. Physical activity releases endorphins, natural mood boosters, and helps to reduce physical tension. Aim for something you enjoy, whether it's walking, dancing, or cycling. Secondly, prioritize a balanced diet. Limit excessive caffeine and sugar, which can exacerbate anxiety symptoms, and stay well hydrated. Thirdly, adequate sleep is absolutely crucial. Chronic sleep deprivation severely impacts mood regulation and anxiety levels. Beyond these, consider incorporating mindfulness and meditation into your routine. These practices cultivate present moment awareness, helping you observe thoughts without judgment. Be mindful of limiting stimulants like caffeine and alcohol, as they can trigger or worsen anxiety for many. And finally, connect with others. Social support and meaningful relationships are powerful buffers against anxiety and isolation. These long-term strategies create a robust foundation for your mental health. It's incredibly important to remember it's absolutely okay to not be okay, and you don't have to face anxiety alone. While self-help strategies are powerful, there are times when professional support becomes essential. You should consider reaching out to a doctor, therapist, or counselor if your anxiety feels overwhelming or unmanageable, despite your best efforts with self-help techniques. Also, if it interferes significantly with your daily life, your work, relationships, or ability to engage in activities you once enjoyed, that's a clear signal. If anxiety causes persistent physical symptoms that worry you, or if it leads to avoidance of situations or places, professional guidance can be invaluable. Finally, if your anxiety is accompanied by feelings of hopelessness or depression, please reach out. There are highly effective treatments like therapy and medication that can provide immense relief and support you on your path to healing. For those of you who want to dive even deeper into understanding and managing anxiety, we have a few book recommendations. First, Dare, The New Way to End Anxiety and Stop Panic Attacks, by Barry McDonough, offers a very practical, direct, and empowering approach to confronting and overcoming anxiety and panic. Next, Unfuck Your Brain, by Dr. Faith G. Harper provides an incredibly accessible and engaging look at the neuroscience behind anxiety, offering actionable advice for improving your mental health. And finally, for those interested in a powerful, evidence-based approach, the Mindfulness-Based Stress Reduction Workbook by Bob Stahl and Elisha Goldstein offers practical exercises to cultivate mindfulness and reduce stress and anxiety in your daily life. These resources can be excellent companions on your journey. To recap our comprehensive discussion today, remember that anxiety is a common experience, but it is absolutely manageable. Start by understanding its different types and recognizing your personal symptoms. Then empower yourself by identifying your unique triggers to anticipate and prepare. Most importantly, practice and apply the practical coping mechanisms we discussed, from the immediate calm of breathing techniques and grounding exercises to the transformative power of challenging anxious thoughts. Build long-term resilience by prioritizing a healthy lifestyle and incorporating mindfulness. And always remember, if anxiety feels overwhelming, it's a sign to seek professional help. You are never alone on this journey. Thank you for joining us on Creatively Homemade Health and Wellness. If this video brought you value, please like it, subscribe to our channel for more wellness insights, and visit animevoracek.net for additional resources. Find your peace, one step at a time.